Hi. It's time to update some of these videos. I've been teaching this work to speech pathologists and other people interested in this work for a long time. When I started teaching this class back in 2013, I did just a real subtle variation on how I learned what was called the thoracic outlet release, which is essentially doing neck traction and sternal compression with this oppositional input thought to be selective for the thoracic outlet, which is the upper part of the thorax, the dividing between the thorax and the cervical region. But the more I've hung out with all of you, the more I've adapted and modified some of these techniques to make them, I think, more relevant, more pertinent, and more applicable to your patient population. So for those of you who've taken the class in the last 3 or 4 years, you've been exposed to this, but just sort of to run through it. We've added a lot of different aspects to this, including with the cervical hand. Instead of just doing neck traction, which I really do by kind of grabbing here on the occiput here, the back of the cervical, or the back of the skull. But I tend to drift down into the upper cervical region. While we certainly can do that, we can play around with a little bit of chin tuck, chin extension, rotation, etc. What I've become a lot more fond of doing is what I call the cat grab. It's like a mother cat picking up the kitten by the nape of the neck. And it's just gathering all this tissue back here, upper cervical region, in a way that when we do it, you can visibly, now obviously this fellow's got no skin, but you can visibly see that line of tension right in through here, in through that hyoidal region. Or if I moved my hand slightly lower and did the cat grab back here, you're going to see mid-thyroid cartilage or even cricothyroid region. Now, what's the point of it? It's pointless unless the patient feels relevance to their issue, relevance to their problem, in a way that feels helpful, useful, familiar, or any of the other myriad of things that they can tell you. So, we can be bouncing around a little bit with this hand in terms of doing traction, flexion, extension, rotation, cat grabbing. But the sternal hand is the one that I probably modified even more, going from pure sternal compression into the midline of the sternum, into allowing my hand to drift well above the sternal notch right here. I'm sorry, I only have one myself doing the filming, so I can't really show you this, but sternal notch is there. Bringing the hand, the heel of the hand up and through here, so I'm grabbing not just at the sternal notch, but above the sternal notch, not pushing down into the larynx, but grabbing hold of the skin there and then dragging downward, all right? In reality, I don't separate them out. I don't do thoracic release or stretch or pressure versus the skin grab. It tends to be a combination where we drag it down as well as compressing. But the neat part is we can easily allow our hand to drift off or drift off. But I'd really encourage you to play with this, where you come in, heel of the hand, base of the thumb, into the skin over the thyroid cartilage region. And as you drag it down, do they feel relevance? Do they feel connection? Do they feel that it feels like a useful stretch? And if so, I'm guessing you get the drill by now. You hang on to it. You stretch. You change the process from peripheral to central and back down to peripheral. How long do you hang around for? Until they feel like it's time to stop, until you feel like it's time to stop, or until change has really been noted. So have fun with this one.